Hello and welcome to Chapter 14. We're going to be talking about drugs affecting the hematologic system. So mostly talk about drugs that function as anticoagulants, or as lay people will say, in quotations, thin the blood. And then at the end we'll be talking briefly about drugs to help you build up your red blood cells. So this is not a terribly long chapter. Chapter 14. 13 pages in the textbook, which isn't a whole lot, and then ATI chapters 22 and 23, but it's a very important chapter, and a lot of the patients we see are going to be on anticoagulants and drugs to keep their platelets from sticking together. So on this in this chapter, we'll be talking about platelet aggregation inhibitors and anticoagulants, and then some drugs to reverse these, and what you need to know for patients who are taking anticoagulants, especially those who are going to be taking them on a long-term basis. So here we have a sort of a schematic of the blood clotting pathway, and it's extremely complicated. I mean, you could have a class solely on the blood clotting cascade and all the factors that are involved in that. And you see there's a whole bunch of them, and some you've learned the names of, like Christmas factor and the factor 8 that has to do with hemophilia. But basically, the very end process is there is some sort of tissue damage or some sort of a condition in which your body feels you're in danger of bleeding. This can be something like a bruise, it can be a cut or a scrape, or it can be some sort of a process inside the body. But the body gets word of some sort of damage. It releases factors that affect the production of a clotting factor called prothrombin, which is a precursor to thrombin, known here as serine protease. And then it causes the release of fibrinogen, which then causes the release of fibrin. Fibrin helps form sort of begins to sort of harden into a net-like material. And if it's on the outside, you form a scab and it stops that bleeding. If it's not too serious a wound. On the inside, you're going to have a stable blood clot. So I've got a video on the reason why we clot. But we're going to be talking about basically 4 classes of drugs. Now, the basis for these are discussed on pages 267 to 268. So make sure you read the introductory material and kind of look at the book's portrayal of the clotting cascade on page 266. Like I said, very complicated, and we're only going to talk about a few points. You will commonly hear people refer to the term blood thinners, but in reality, these drugs don't actually thin the blood. The only thing that thins the blood is fluid in the bloodstream. But we usually will refer to blood thinners. We're talking about anticoagulants, which it's a whole different outfit. They will not dissolve existing clots. The only thing we do with anticoagulants is we try to prevent clots we have from getting bigger, and we try to prevent more clots. So we'll be referring to some of these drugs as the anticoagulants that they are. Some drugs inhibit the action of platelets, and platelets are blood cells that clump together and stick together to form a clot inside the blood vessels, and that's part of this clotting cascade, although not exactly the same thing. We will talk about a more new category of drug called the direct thrombin inhibitors that interfere with factor II or thrombin. And we recognize these drugs by name because they're still being advertised on TV. Then we have the indirect thrombin inhibitors that affect factors that ultimately affect thrombin. And these are known as the heparins and the low molecular weight heparins, the kind that are injected subcutaneously. And then finally the vitamin K antagonists. And these are oral medications that block the action of vitamin K. Vitamin K is necessary working in the liver to make for the smooth progress of these clotting factors. And if you interfere with it, you're not going to form clots the way you ordinarily would. And the most common of these is warfarin or Coumadin. There are a number of families in that, or drugs in that particular class. Many times they're called coumarin type drugs, but warfarin or Coumadin is the most common that we're going to see.